Have you ever had sharp stabbing pain in your heel or arch of your foot? Or have you ever had those first few steps out of bed in the morning feeling like you're walking on shards of glass? If you have, you may already be familiar with a condition called plantar fasciitis. Hi, I'm Dr. Joe Sturges, and I want to take a few minutes today and go over what is one of the most common conditions that we treat here at Sturges Chiropractic and Sports Medicine, plantar fasciitis. Plantar fasciitis occurs when there's inflammation and irritation of the plantar fascia, which is a fibrous band that runs from the heel to the front of the foot. Now, this structure is very important because it not only provides support and structure to the arch, but also provides shock absorption as we go through a normal gait cycle. The underlying causes of plantar fasciitis can vary greatly. Prolonged standing, running on uneven or inappropriate surfaces, having either too much arch in the foot or too flat of an arch can all predispose you to this condition. One of the other most common things that we see that will kind of predispose plantar fasciitis symptoms to patients is wearing inappropriate footwear. And we see this much more commonly in the summertime, where we'll certainly see an uptake of these cases in the clinic due to people wearing sandals or flip-flops or walking around barefoot. Treatment really focuses on reducing the inflammation in the plantar fascia and restoring normal movement and biomechanics of the foot. To that end, we'll use manipulations of both the ankle and the foot. Certainly we'll utilize stretching and strengthening exercises, not only in the foot, but up to the knee area and the hip as well, to kind of correct for that whole kinetic chain. One of the most common treatment techniques that we use in here is called Graston technique, and it's a wonderful technique that breaks up scar tissue and adhesion within those soft tissue structures. We also will commonly have conversations, again, with what is appropriate footwear for this patient concerning the activity that the patient's doing, and also a conversation concerning orthotic inserts when appropriate. Hopefully you've learned a few things about plantar fasciitis today. If you or a loved one is experiencing any pain in the foot or the arch, please feel free to reach out, give us a call. We'll be happy to evaluate it and come up with a treatment recommendation for you. I also want to give you a heads up for later this month. We're going to release a second video that's going to show some of the common treatment techniques that we use both in clinic here and also give you some tips for treating this condition on your own at home. So again, be on the lookout for that. Thanks.